Hello, this is Robert Welch from Health Plans of Illinois. Thanks for joining us for a short update on the Obamacare system. We are specialists in helping people navigate through the healthcare reform system known as Obamacare and also known as the Affordable Care Act, or ACA. We offer what we call our Simplify It kit, which is a customized program that'll help narrow down your options, help you see plans side by side, and also give you an estimate on any subsidies if they're available. Our system is fully integrated at our website. That's healthplansofillinois.com. We can be reached at 888-444-9051 or shoot us a quick email, info@healthplansofillinois.com. The main starting point for this discussion is, do I need Obamacare? Well, not if you're the age of 65 or older, and also not if somebody else is paying for most of your coverage, for example, your employer or the government. But otherwise, you probably do need to have access and go through the Obamacare system. And basically, this is how the new marketplace looks when we compare from what it was, which was the private marketplace. That's what we have now, and that's been there for decades. You've got a number of private insurers that are competing on price and plan design, and there's a lot of options there, but that's all going to change when we add this new part of the system, and this is where the government is getting involved. Even though the insurance companies are administering the government plans, the government's adding a new element, and anything that you get on the government site through the government marketplace is called on exchange, and anything that you get off the government site is going to be considered off exchange. So there's over 150 plans on exchange, and there's even more than that when we go off exchange. So that's a quick picture on how the new marketplace looks. And actually, a big part of our discussion today is showing you the different paths on how you get to the marketplace. And there's actually two pathways. The one that's been the most promoted has really been the government website, which has all kinds of problems so far. Since October 1st, this is October the 18th, we've tried to access that multiple times daily and have not yet gotten in. So it has had its challenges and has had some technical difficulties. But just so you understand, when you're looking at the government marketplace, here's how you enter. You're going to shop it yourself, and you're going to go into the government website, and from the government website you will be able to be qualified, if at all, for any subsidies. Subsidies are basically free money that the government will contribute towards your health insurance premium. So on the web, when you go through the website, they want you to sign up first, then you get checked out for subsidies, and at the same time you can start shopping all the insurance plans, which is over here in the on exchange system. So that's the one that's been heavily advertised, and that's also the path that has so far had quite a bit of problems. The other way that you can go in is to enter through a broker, and when you go in through a broker, what happens is you're able to go to both the off-exchange marketplaces and the on-exchange marketplace. You can have all those shop first, and at the same time, in one process, you also get access to the government subsidy qualification system. So if in fact you are entitled to a subsidy, going in through the broker path is also going to get you access to that free money if you qualify. So you can either shop one, or you can get it all taken care of in one step. The cost is the same, so it's free whether you do it yourself or you have a broker. So let's look at those options side by side. If you look at the actual broker path, you're going to get professional help, and they're going to help you shop all the plans, the insurers, and the subsidies first, and they're going to get access to both the on-exchange and off-exchange plans, and the agent will do all that work for free. The only downside is if you use someone who does not have access to all the choices on the marketplace, so that's important to make sure that the person you're dealing with has that access. We at Health Plans of Illinois have access to all the major carriers, and that's available through our system. Do it yourself. You get the satisfaction of learning insurance plans if that's what you like to do, and you also know for sure that you're going to see all the on-exchange plans when you go into that site. Whereas if you had a broker that really worked for one company, maybe they're not even on the exchange, or if so, maybe they're only one company and you won't get to see everything. So So you know you're going to see all the on-exchange options, but the downside of that path is that you're only shopping the on-exchange plans. You're going to have to shop the off-exchange plans separately, and of course, you do all the work. So that's another comparison on the different pathways to the Obamacare system, and why wouldn't you want help for free? That's basically what you're getting through the broker path. Okay, let's talk a little bit about subsidies, because this is going to be very important. When we look at subsidies right now, if you looked at, I'm going to give you an example. The subsidies are available to anybody with an income that's less than 400% of the federal poverty guideline. So if we look at a sample, I've got a family of 4, and if I'm making less than $94,200, I'm most likely going to get some free money towards my coverage. And as I go down the income scale, my subsidies will increase and get bigger. I'll show you an example of someone who basically has all their premium covered by a subsidy. And so some people will be very fortunate here. And if your income is even lower than the 133% guideline, you now are going to potentially be in an area where you could get Medicaid or CHIPS, which are both low or no cost options. CHIPS is the Children's Health Insurance Plan. So subsidies will be important, and from our experience, either you're going to get a subsidy, and if you don't get a subsidy, most likely you're going to pay a subsidy, because the premiums for these new plans are higher than what we've been used to. So very important to understand how subsidies work. Here's a sample of our Simplify It kit, and this is just a short little excerpt from that, but it's going to show you a couple things. One, it's going to show you how we compare plans side by side, and two, it's going to give you an example of an actual subsidy. So we have a consumer that's the age of 60 with an income of $20,000. Okay, and we've calculated that the subsidies potentially will be $496 a month. All of the insurance options that we're comparing, we've got 4 plans here side by side. These are the monthly premiums after the subsidy's been taken out. So if this person did not get a subsidy, their premiums would be $496 more a month. Okay, and the way you have to really look at all these plans is, remember, the premium is just the monthly cost before you have any claims. So the real way to compare plans is to see how they look as your level of claims increase, which we're showing you down here. Okay, so in this first plan, if I have no claims, that means that my annual cost is just my premium. But if I do start to have claims, our system automatically will highlight here in orange the lowest cost option for each plan that we're comparing side by side. Notice in this particular example is after we reach 2,000 of claims, this plan over here starts to look a little bit better. But your decision is, should I pay the extra $113 a month to potentially save $238 in claims if I have $5,000 in claims? And again, we don't know what our claims are, but this is a good way to help you understand what plans look like. And also notice that as your claims go up, for example, in this option, the most you're going to pay in any year is $6,000 here. Okay, you can see that the most you'll pay in this plan is $10,000, and so forth. So this is a small piece of what our Simplify It kit looks like, but it'll give you an example. And you can't just look at the premiums on these plans. You got to look at the total cost in case you have a certain level of claims, and you have to know what your worst case scenario is. So hopefully you'll give us a shot and take advantage of our free Simplify It kit. Hope today was meaningful to you. And let us do it for you. It's free, and it's healthplansofillinois.com. Thank you.